Hi, YouTube, what's up? My name is Ellie. I'm a trans guy and a non-binary person. I've been filming my journey with gender for the past 3 or so years. I have been on hormone therapy this whole time, taking testosterone. I started very, very, very low dose and I kept that for like a year and some, if not 2 years. Now I'm currently on full dose and I am going through the movements to get top surgery. Yeah. We're getting top surgery. We're getting top surgery. We're getting top surgery. Yes. Okay, so the GoFundMe link to help me get top surgery is in the description down below. Please help if you can and if you want to. And for me, on my part, as long as I'm asking for help, I want to put help out there. This is why I'm going through experiences that I've had, thoughts that I have about gender in my personal life, and kind of try to share that and talk about that so people like us can have resources. Okay, so this week I went into a consultation with Dr. Musolas. Now, Dr. Musolas is the second big surgeon of top surgery that we have here in Barcelona. He actually might be the first one, like in terms of how many patients he's seen and how much experience he's had. He's probably the leading one. He says that he has about 500 surgeries under his belt, which he presented as a lot, but coming from the American standard, even though I'm not American, but I have been mostly looking into American content on the subject because that's just like the biggest pool of English speaking content that there is out there. So I know what a Garamoni surgery looks like, I know what a Medellin surgery looks like, and they do have better results than anything I've seen so far in Europe or in Israel. So hearing a surgeon boast about having done 500 was a little bit like, bruh. Do you know your field? But apart from that, he's a great surgeon. He's got some very good results. I have seen just basically guys with very, very, very like cookie cutter but good cookie cutter results, like the very small nipples, the perfectly situated pec line, and then the same thing for absolutely everybody. So his best work is of course on skinny muscular guys, and his less great results are on people with a slightly different build, like if someone who is still quite physiologically feminine in his features, doesn't really have any muscle mass, it's kind of hard to find a pec line, that sort of thing doesn't come out so good with him. Also, very large breasts or a body that has more fat deposits, that seems to be a challenge for him. Doesn't get as good results as he does with the clearly defined pectoral muscle that doesn't have a lot of fat around it. Which is kind of okay for me because given the fact that I've been training for most of my adult life and that I've been on testosterone for 3 years, I've been told by 3 doctors before him and also by him that I have a clearly defined pectoral line. It should be around, yeah, that's the line right here. I don't know if you can see it through the shirt and the binder. See, that's the muscle, that's the tit. Okay, so, and when I take my shirt off, it's obviously evident, like I have muscle and then breast. So it's quite easy to see with the naked eye even. So I've been told by all the surgeons that I've been to that it's fine, it's going to be easy, you're going to have a good result and the rest of it. So I do expect that if I undergo surgery by him, that it's going to be like one of the better results that he has, which is cool. It's really calming to know that you might have a good result for your surgery. It's definitely better than going in and being worried about these things. So what kind of also factors into my decision? So I went in to see him, and I felt like he was very gatekeepy, in the sense that the first 10 questions out of his mouth were like, maybe not 10, maybe 5, but like the first 5 questions out of his mouth were things that were kind of like interviewing me whether or not I'm trans enough to get the surgery done by him. Which honestly, like, I am 35 years old. I'm a healthcare professional. I am sound of body and mind, I am capable of making like life decisions that affects my body and my health, and I don't need babysitting for it. So I understand the like paternal urge for doctors in general to sort of protect patients and make sure that they're making the right decisions. This is what leads to gatekeeping. Okay? It's basically well-intentioned people, well-intentioned health professionals who don't believe that you have the sufficient agency over your own body and mind to take such decisions. And it pisses me off because I am a health professional. So I am aware of the fact that the criteria is to establish that you have this authority, that you should be able to take these decisions. They're actually quite simple. So what you want to see that you have in front of you a person who is not currently suffering from like psychosis or distorted perception of reality. And when I say that, I don't mean like that they have ideas you disagree with. I mean that they recognize reality and are capable of making sound decisions, which is a very, very simple thing. Like if you're not right now under any acute stress, like there's not a gun to your head, you're not late for the presentation of your life at work, your son isn't being born in the other room, you're under normal conditions, you're not hyper stressed, then you should be able to take a decision like that. And then even if you have a mental condition, mental conditions don't exclude your capacity to have judgment and to make decisions. Some mental states do. Some mental diseases or mental conditions, they actually do take away your ability to make these decisions. But that's not something that a plastic surgeon can determine in 5 minutes of interviewing you. That's why it's gatekeepy. Like, you want me to do one visit to a psychiatrist or a psychologist to evaluate my mental state and my capacity to make elective decisions, like decisions over elective surgery. That's fine. I get it. But then I think it should be a requirement for any kind of plastic surgery. If it's a requirement for me, then it should be a requirement for everybody, because all plastic surgery is basically irreversible. And everybody who makes these decisions, if we think that one of them has to be comply with a certain standard, and all of them should comply with a certain standard. And I've never heard of someone needing a psych referral for a nose job, So that pisses me off. I think it's hypocritical. The first 10 or 15 minutes of the interview were devoted to him making gatekeepy questions. Like, how old were you when you first thought you might be a boy? And how long have you been wearing men's clothes? And all the rest of it. Now, I can make my personal history sound very classically trans. Like, I can tell the story in a way, and I wouldn't even be lying, but I could tell the story in a way that makes it sound like I'm the transest guy in the world. And I kind of did that for him, because I think if he feels like he has the right to gatekeep me, then I have the right to bullshit him, right? Because eventually it's about my agency in taking a decision, and I feel that I have the agency to take that decision. Like, that I have spent long enough thinking about this surgery, and long enough considering the repercussions in the process, and I know that I want this, I know that I need this, and the details of my journey are really not up to him to judge. I'm willing to tell it to you. I'm willing to tell it to other trans people who are on the same journey, to other cis people who are curious about it. But someone in a position of power to make decisions over me, I don't think that is privy to this knowledge. I don't think they have a right to the details of my personal life for them to make judgment over me, especially not when it's about something that important as top surgery. Like, I literally don't think he deserves to know the answers to the questions that he's asking me. Specifically because he's in a position of power to make decisions over my life, which I don't think he should have. Like, if he wants to make them as a person, because of, I don't know, his morals, his religions, and all the rest of it, that's a perfectly valid stance. But as a doctor, it is not his place. As a healthcare professional, it is not his place to make a moral judgment over me and my sanity, because he's not a mental health care professional, and his specific opinions about transness are not a relevant part of the equation. There is a standard about this that has been written. He's not in a position to make these decisions, to me anyway, personally, which is why when he asked me certain questions, I gave him certain answers to sort of put him at ease. And even though they were true, you know, they weren't the whole story. So like he asked me like, how old were you when you first thought about it? And I said like, yeah, I can remember myself at like 6 or 5-year-old thinking like, what if I'm a boy, you know? And you know what? I don't think that makes me very trans. I think that all little boys and little girls have like thoughts about these subjects. Like they kind of like are curious about this or wonder what makes people boys or makes people girls or what would have happened if they had been born a boy or a girl. I think it's a very natural human moment, you know? That's one example. And did I know I was trans when I was 6 or 7? No, I did not. It took me until basically 3 years ago, not even 3 years ago. Like it took me a year and a half into my hormonal transition to actually come to terms with the fact that I am trans and be able to accept it. You know, it's not something that I knew when I was 5. And then he asked me like, when did you start wearing men's clothes? And it's like, when I was a kid, you wore a shirt and a pair of pants. And if the shirt was blue and the pants was blue, that didn't mean you wore like girls' clothes or boys' clothes, because everybody wore the same shit when I was in preschool, right? So like the girls and the boys, I don't know that they were different things, you know? Every once in a while they would stick me in a dress, and every once in a while they would stick me in a pair of jeans. Like I was a kid, you know? And the older I got, the more I vindictively chose to have women's clothes in my arsenal, so people wouldn't say that I dressed like a boy. So it's really not a good way of measuring my authenticity as a transgender person, asking me that question. You know, and also knowing that I'm a circus and a performance artist, and that I play with gender roles and gender presentation also in my performance. And my performance cannot just be when I'm on stage. I can choose to do a performance while I'm having a job interview. So I really don't feel that he has the capability to appreciate and judge the information that I would have been able to give him, nor was it his place to ask for it, nor do I want him to have power over me in taking that decision by himself. So I kind of gave him like the bits that he needed to decide that I was trans enough, and that's it. And then we moved on. He gave me a very detailed explanation of how he does the surgical technique, which was kind of interesting because I am a healthcare professional. And he went into what kind of incision that they make and how they remove the tissue and shaping the scar afterwards and placing the nipple and all the rest of it. And the hookup and all that. Blood irrigation. Quite interesting stuff. I don't want to repeat it here because I think it's been done to death. And also because the details might be gory. And then I really don't feel that it adds anything. You know, it's a surgical technique. If you're interested, hit me up. I'll explain it to you. So we go into that in great detail, and then I ask him, okay, that's wonderful. Can I please see some results? And he whips up like this slideshow, which I have been able to find online before coming to see him. And I told him, Dr. Musolas, I had actually been able to go through this before I went to see you. Do you mind if we go through some of the results that your patients had had? Like you've commented that you have had 500 successful surgeries, out of which only 2 people have lost a nipple. I'm sorry, he said he lost 3 nipples. I'm not sure if it's 3 different people or somebody lost 2 or, you know, what the hell. But he said in 500 surgeries he lost 3 nipples. So I was like, okay, may I please see photos of results? And he was like, yeah, I could do that, but I'd really rather just show you the slideshow. And I was a little bit frustrated in that, I have to admit, because I really did want to see other results. Like, the slideshow only had 1 patient, which was similar to me in physical build, and the rest of them were kind of like either a lot skinnier, a lot heavier, a lot smaller, or just a distinct, like a completely different kind of breast. Like, I did not appreciate like being sort of talked around like that. It in general, you know, it's a doctor. He's not going to cater to your particular wants and needs too much. He's a plastic surgeon. I didn't expect that, but I would have preferred to end up seeing more of the patients that he had operated on. So to end it all, I kind of asked him something that had been important to me, which is because I'd gone to see Dr. Tintore, and he said that he was going to also do liposuction on the sides of the torso. I had asked Dr. Musolas if that was possible with him too, and he said, look, it's a separate procedure, and we don't normally do it with the mastectomy. And it kind of got the feeling from him like he didn't see that it pertains to the same process. And I was like, okay, you know what? I'm not going to insist on that. If I see that I am more convinced by his results than with Dr. Tintore, then I will go back and ask about it, because he said it will also change the price. So what haven't I covered? So the price is 5,600 euros, which is cheaper than Tintore. Tintore was 6,200 euros. I kind of feel bad for mentioning the price, but why shouldn't I mention the price? I mean, like, trans people need to know how much this stuff costs, and the fact that they don't put the price out there in the open, that's like, it's kind of like, you know, it's like a company policy. It's like a market thing. Like, why should I protect it? Anyways, it's a bit cheaper, but then they don't cover any revisions, and there is no post-op care. Dr. Musolas says that's because he has a lot of patients from other European countries, so it didn't make sense to have like post-op care. But that all of the visits to the anesthesiologist and the clinic where I'm going to get operated and all the rest of it is covered by the initial price. Like it's just one price. Like it includes, I think, also the post-op vest and the hospital stay overnight, which is another thing. So they're going to do the operation in a place called Clinic Pilar, which I think is a clinic and not a full-fledged hospital. Now, I have a friend who's very insistent on the fact that I be operated on in a hospital. He says if anything goes down that's a little sideways, you want to be in a hospital where they have all the means to do whatever operation is needed on you to save your life or save your results. And I'm like, yeah, it makes sense, but it's really hard to ask a surgeon to perform. Yeah, it's like something you cannot influence, right? It's either this or that. So I did not get a clear understanding from Dr. Musolas on whether they're going to do the surgery in Hospital Pilar or if it's Clinic Pilar, which is basically sounds like the same place, just not sure if it's a hospital or a clinic. Yeah. So, to conclude, Dr. Musolas is an excellent surgeon. He has, according to him, the most experience in Spain in doing these kind of surgery. He's a cookie cutter surgeon, but it's a good cookie cutter pattern that he has. He makes the scars, you know, slightly angled from the armpit towards the middle of the chest the way I wanted them to be, and not downward sloping the way I didn't want them to be. He makes very small nipples. He has very good success with people with a muscular build, and he considers me to have one. He's kind of gatekeepy in an old school fashion, and there is no post-op care. It just seems like he's a surgeon who does the surgery point blank, which in the long run, I think the most important for me is results. Not necessarily my surgeon being the kind of person that I can relate to, or them having the kind of views on the world that I share with them. Like, I don't really give a shit about his political position about trans people. I just want a good surgery. So, although I did go into that in a lot of details, I'm not sure it's a factor in me having like the final decision to be operated on by this man or by the other. Price is a little bit lower, which is nice. But right now, I think I can almost afford it. I almost have the funds together to be operated on by Dr. Musolas. Not so much for Dr. Tintore just yet. I'm like 800 euros short or so. And yeah, that's basically it. Thank you so much for watching the video. Any kind of questions or anything that you want to know that I didn't go into, go ahead and ask me in the comments. I try to get back to everybody as much as I can. And see you in the next one. Cheers.